Hello, and I'm Angela Andrews. I am from Haliburton, Ontario, and I began the MPH program in 2016. And I'm excited to be wrapping up and sharing with you a summary of a policy discussion paper on ecotoxicity and the implications for public health. I've worked as a health promoter in public health for almost 18 years and had a strong interest in furthering my knowledge in policy work. So I was able to find a great opportunity with the Canadian Public Health Association in the policy department. And I didn't know that Sarah was going to be there. Next slide. Whoops, jumped too quick. I would like to begin by acknowledging the land on which I'm currently located is the traditional territory of the Haudenosaunee and Anishinaabe peoples, territory that is covered by the Upper Canada Treaties. I would also like to acknowledge and thank my practicum supervisor, Frank Welsh, my workplace, the HKPR District Health Unit, my UVic professors and fellow MPH grads, and finally my daughter Ruby, my partner Randy, and my friends and family. I couldn't have made it through these 4 years without you listening to my constant worry and complaining. And I think I've gained a few gray hairs. So ecotoxicity refers to the potential for biological, chemical, or physical stressors to affect ecosystems. The purpose of the policy discussion paper was to investigate the public health implications of ecotoxicity in Canada and provide recommendations for community response. After doing initial research, I realized I needed to narrow the scope to focus primarily on chemical toxicity and the synthetic chemicals or fertilizer, which includes nitrogen, phosphorus, and potassium, pesticides, and microplastics, and how these are affecting our environment and public health, and if there are any policy recommendations to put forward. Chemicals affect our everyday lives. For example, fertilizers and pesticides play a crucial role in feeding the global population. Plastics are used for packaging and to extend the shelf life, and antimicrobial medicines in animal and human health have been used to treat, control, or prevent disease caused by microorganisms and to improve production, growth, or reproduction. Globally, we know that more than 140,000 new chemicals and pesticides have been synthesized since 1950. Yet, because our use of chemicals has increased substantially, it's resulted in bioaccumulation, meaning chemicals do not break down, but they persist and accumulate in the soil and aquatic environments. Ecotoxicity is destroying our air, water systems, forests and crops, and the quality of our soil and land. Pollution is now the largest environmental cause of disease and premature death in the world today, costing families, businesses, and governments tens of billions of dollars each year. I feel like the advance is very slow. To have a better understanding of how ecotoxicity affects public health, a summary review of literature was used, which also included research for policy recommendations, and these were the methods I used. It was challenging to find the key terms since there's such a variation in terms for this complex topic. Part of the research process involved looking back at the history of industrialization and how it transformed society. The technological advancements through machine-driven production and manufacturing resulted in increases in consumer goods and easier production, which led to an improved quality of life, population growth, and urban expansion. However, with such advancements also came the harsh reality that we're poisoning our organisms and ecosystem, which is affecting our health. During the research process, I came across two interesting and influential pieces of history. One, Rachel Carson in her book Silent Spring, which was released in the 1960s. She brought forward the concern of using pesticides such as DDT and how such toxicants were noticed to biologically cause changes in fish and other species throughout the food chain, and introduced the idea of bioaccumulation. And two, in the late 1970s, Dr. Ross Hall and Dr. Donald Chant with the Canadian Environmental Advisory Council wrote a report to the Minister of Environment and indicated that chemicals were affecting and injuring species, therefore they must also be affecting mankind. What's interesting is that the recommendations they made in the late 1970s are still very applicable to the government and policymakers some 40 years later. Looking specifically at public health implications for fertilizer, pesticides, and microplastics, nitrogen, phosphorus, and potassium play an important role in plant nutrition and is the food that helps plants grow. It's the fertilizer. Nitrogen naturally cycles through the air, soil, and water, yet humans are now altering the nitrogen cycle through the use of man made synthetic NPK. The concern is that there's an excess amount of nitrates and phosphates being added to the ecosystem and disrupting the nitrogen cycle. When you create excess waste, it filters off into surrounding water systems, forming toxic algal blooms, producing poisonous toxins which are affecting our fish population as well as our health. Pesticides remove or control harmful pests and increase crop yield or protect against vector-borne diseases for public health protection programs. Pesticides have helped with population food demands and enhancing food security. However, through research and public awareness, we now know that pesticides are linked to a variety of harms associated with human health, pollinators, waterways, farm workers, wildlife, ecosystems, biodiversity, and more, and can result in cancer, hormone disruption, and affect reproductive health. Lastly, microplastics are small plastic particles less than 5 millimeters, and they are an emerging environmental and health issue throughout Canada and the rest of the world, and they don't biodegrade. Canadians produce a lot of plastic waste, an estimated 3.3 million tons per year. About 2.8 million tons of plastic waste ends up in Canadian landfills every year, which is equivalent to the weight of 24 CN towers. As you likely know, plastics make their way into our environment and end up in our drinking water, food, and marine life. From the research, I realized that the legislative and regulatory policies were all over the place and confusing. This slide is to highlight and point out the various sectors within the Government of Canada that deal with ecotoxicity. Ecotoxicity is a complex environmental and public health issue that crosses many jurisdictions and federal regulations. If you think about what contributes or is affected by ecotoxicity, it ranges from water, chemicals, soil, food, fish, and more. So no wonder it crosses many jurisdictions. Currently in Canada, we lack a comprehensive national health and environment framework, one that specifically targets ecotoxicity and supports public health and environmental health goals and objectives. Although Canada has adopted the Environment and Climate Change Canada framework and is implementing a pan-Canadian framework on clean growth and climate change, these both lack a comprehensive public health aspect. CEPA, the Canadian Environmental Protection Act, is one of Canada's most important laws that contributes to sustainable development through pollution protection and prevention of the environment and human health from risks of toxic substances. And although it reflects some aspects of public health through being proactive, preventative, and precautionary, there has also been criticism that it's been outdated and hasn't kept up with current language and research. And finally, through the research, I was able to identify these policy recommendations. One, develop a national enhanced surveillance and monitoring system for pollutants in Canada. Two, develop a national health and environment framework to address ecotoxicity, one that is multidisciplinary and multisectoral. Three, develop an online accessible platform to inform the public and health professionals about environmental contamination and to hold industries accountable for toxic products and releases. Four, update CEPA to modernize language, science, public health risks, and amend CEPA to include the recognition of a right to a healthy environment. Five, invest further funding into health and environmental research. And six, strengthen Canadian laws and regulations and policies as they relate to public health and the environment. The air we breathe, the food we eat, and the water we drink are reflective of our natural surroundings. Our quality of life and our health are influenced by the environment in which we live. The public health implications of ecotoxicity need to move to the forefront of policymakers' agendas. We need to see a shift in policy regulations and laws to support the right to a healthy environment in Canada and one that supports public health. Any questions?
Awesome. Thank you, Angela. Are there questions for Angela? Nigel?
Well, the same applies. If there are any other questions, let them go ahead of me. But okay, Angela, a very interesting talk. One of the things that have occurred to me actually when I was reading your paper, your report, and that is obviously there's been a very high emphasis on sort of high input agriculture in Canada and the rest of the world, and so that's leads to the applications of fertilizer, high applications of fertilizers and pesticides, etc. And yet at the same time, there's a huge amount of wastage of food that goes from the farm to the consumer. And I just wondered if you wanted to speak a little bit to a possible solution around reducing, and I can't remember the exact numbers, but I believe it's around about 20 to 30% of the food that's produced at the farm is actually wasted before it gets to the consumer. And I wondered if you wanted to just comment on that, perhaps.
I didn't actually come across a lot of research on that specifically, Nigel. And so I think, it's interesting because I think Sarah would actually have more information on that than I do. It's really also interesting how our presentations were very similar and how we actually worked at did our practicum at the same place. But I can't speak to that specifically because I didn't really come across much information to do with that. So yeah.
No, fine. That's fine. Yeah, I can't remember the numbers off the top of my head, but it's extraordinary how much food is wasted at farm gate, essentially, or getting to the consumer. So anyway, excellent work.
Okay, thanks, Nigel. I just wanted to comment as well, Angela, that such a complicated topic that you've managed to.
So complex. It was so hard.
Yeah, exactly. And I was interested in how did you get interested in this particular topic? What made you pursue this for your project?
Well, it's interesting that you bring that up. So when I was speaking with Frank, we kind of talked about how I have worked mainly in the area of injury prevention, chronic disease. And so to, step outside of my comfort zone and do something a bit different, he said, oh, well, I've been doing some research on, artificial intelligence, ecotoxicity. And so he basically assigned me those topics along with, it was tobacco prevalence and, tobacco taxation and smoking prevalence. And I was like, oh my gosh, could you not choose any harder topics for me to pick, for me to do? And so I started looking at artificial intelligence and the implications of public health. And that was massive. So then I settled on ecotoxicity because it had been around for a little while at least, and some of the research was actually out there that I could speak to and actually form some recommendations around. But the more I got into it, it was like the more I was going down into the rabbit hole where it was just such a huge topic. So I definitely had some challenges along the way. And I thank all of you who listened to me complain about how stressful it was. But the more I got into it, the more I understood. But to begin with, honestly, I didn't even really know what ecotoxicity was all about. So now I do.
Yeah, awesome. Great job, Angela, for just diving into something like that. It takes courage. It takes courage.
Super hard. So thank you.
Well, good for you. And I think that's one of the goals of the Culminating project is to explore something new and to lean in, to the uncomfortable.
Sure. It was a really wonderful experience. And I can't thank Frank enough. He was very supportive and yet he listened to my concerns, and same with Nigel, you did the same. And so it was great.